Many of us will catch a cold this winter and feel better after a few days. It's very common, and it's very infectious, which means it spreads easily from person to person, including toddlers and babies. The virus responsible for most colds and coughs at this time of year is called RSV. If you catch RSV, you will probably have mild symptoms like a runny nose, a cough, or a fever that lasts for a short time. But if your baby or toddler catches it, they could go on to develop a chest infection called bronchiolitis. Bronchiolitis is a common infection in children under 2 years old. It makes the airways in their lungs become inflamed and full of mucus, and this makes it harder for them to breathe. Some infants who develop bronchiolitis need hospital treatment, especially if they have a health condition. Babies and children are more likely to get very unwell with bronchiolitis if they are aged under 3 months, were born early, prematurely, have heart or lung problems, have a weak immune system, have a condition like muscular dystrophy. What are the signs? It's important that you recognise the signs of bronchiolitis and understand when you should visit the doctor or call for emergency help. Most cases of bronchiolitis are not serious and clear up in 2 or 3 weeks, but the symptoms can be very worrying. Early symptoms of bronchiolitis are the same as a normal cold, a runny nose and cough. But then a few days later, you might notice your baby or toddler has a very high temperature or fever, a dry cough that doesn't stop, problems eating, wheezy, fast and noisy breathing. Most of the time, you can look after your baby at home until their symptoms eventually go away. Trust your instincts. Talk to your GP or call 111 if you are worried about your baby or toddler. You can make it easier for your baby to breathe and eat by keeping them sitting upright. Using saltwater drops from the pharmacy can help if your child's nose is blocked. Try to feed your child smaller amounts but more often. And make sure they drink lots of water or diluted fruit juice in between each feed. If they have a fever, you may be able to give them paracetamol or ibuprofen depending on their age. Always remember to follow the manufacturer's instructions. Most children will slowly begin to get better after a week, but others may start having more severe symptoms. Call your GP or NHS 111 if your child is eating much less than usual, has a dry nappy for over 12 hours, a temperature over 38 centigrade, or if they seem very tired. Don't wait to call 999 for an ambulance if your child has difficulty breathing, with long pauses between each breath, or if their tongue or lips are blue. Your baby may need to stay in hospital for a few days until doctors are sure that they are getting enough oxygen in their blood. Remember, while the symptoms of bronchiolitis can be very worrying, most cases are not serious and will clear up in 2 to 3 weeks. Take a look at our information about RSV and bronchiolitis on our website www.contact.org.uk/RSV.